Hello, everyone. Welcome back to the discussion of mental health on Spotlight and Community. We are here because of Moksha Canada Foundation. We thank you very much for allowing us to be here and have this conversation with our amazing guests. My name is Lynne Mchte. I'm your host. I humbly arrive on the scene to be with you and share in this conversation. It is a national conversation, and we have a guest, Sheryl Boswell, who's back from Youth Mental Health Canada, who prepped the conversation for mental health for us. And we have Lisa Browning, who is here from 1000 Trees. And I'd like to start out with just saying hello to Sheryl before we jump over to Lisa. Hi, Sheryl. And hello, Sunil. And hello, Anu. Thank you for joining us. Lisa, I wondered if you could tell us about you. I'm enthralled with you and all the work that you're doing. And we've talked before in other programs. And I felt it was very appropriate for you to jump into this portion of our program because you've done so much work on the grassroots level in the communities. If you could speak to us about who you are and maybe introduce yourself a bit.
Oh my, okay.
Let me get my long list.
I founded 1000 Trees in 2010, I believe, 2009. And actually at the time I had was just in the process of leaving a very abusive relationship, a mentally, emotionally abusive relationship, which landed me in hospital with PTSD.
Mm-hmm.
And I think that's probably what my motivation was to develop a platform for people to speak their truth, because we talked last time about the stigma, especially with mental health issues. I know vulnerability is frowned upon. I think it's changing, but it used to be, I can't be vulnerable. I was like that. I can't be vulnerable. I have to be strong. Well, I think it's important that when people are struggling, they need to be able to talk about it. So yeah, so I founded 1000 Trees back then. And at the time it was it was a online magazine, which was focusing on health and wellness, community service, connection. Over the years, and especially as I have processed my own journey, having come through what I've come through, the mental health side of it has been more prevalent. So I just actually sent to the printer volume 7 of an anthology called Sharing Our Stories, Ourselves, Our Success, which is stories about overcoming and challenge and adversity and that sort of thing. So, and there's been a great response for it. I did the first volume back in 2013. Thought it was only going to be one.
But I think that's what I met you.
Yeah, I think so. But people responded so well, and it was beneficial for both those who told their stories, but also for those who read them. Because people would look at those stories or read those stories and say, oh my God, there's somebody else out there that's gone through what I'm going through right now. Mm-hmm. So because of that response, then I got, actually a male friend, my story was in volume 1, as was another friend of friend. So this male person, read both of our stories and said to me, you really need to do a book on men. At the time I was splitting between men's and women's stories. I don't do that anymore. I said, well, didn't think about doing that. He says, well, I think there's a need. It would be a different kind of volume. But so in the back of my mind, I thought, well, if you write for me, I'll do it. Asked him the question. He said, sure. So volume 2 was born. So I did alternate between, well, let's go back. The interesting thing about the 2 volumes, when I talked to the writers in volume 1, their response was overwhelmingly, thank you so much for giving us a platform to share.
Oh,
the men in volume 2, thank you for letting us be vulnerable. It was, I mean,
quote unquote,
across the board. Yeah.
Wow. Yeah.
So then I just continued. Recently, in the last couple of volumes, I don't differentiate, they're gender neutral, because I realized, oh, I really shouldn't be doing that. That's come more to the forefront lately too. So yeah, I've just done volume 7, and it seems like now I'm getting people contacting me saying, when's the next one coming out? So there's definitely a need out there for that.
Mm-hmm. And speaking to the storytelling aspect in terms of our mental health and well-being in our communities and the richness of our communities because of our storytelling, would you mind speaking to sort of I guess the true definition of why you, what 1000 Trees is? You're telling stories based on people's...
Well, it's evolved. So at the time when I did this, when I started all of this, I was involved in a lot of community service, and I was on a lot of committees, and it's like, I don't want to sit in meetings all the time. So I stopped everything. But because I believe strongly in giving back, that I have to come up with something that's going to replace all that. So I had thought about doing a magazine on health and wellness and all the things that are important to me. So it sort of developed in my mind, and then I was trying to come up with a name for it. So people always think, 1000 trees, what is that? What, do you plant trees? Do you, right? So people in Guelph may be aware of this. People outside may not be. There at the time was a local teacher at one of the high schools here who had been diagnosed with stage 4 lung cancer at the age of 46. He was not a smoker. He was on the national rowing team. He was outdoorsman. He founded I believe he did found the Community Environmental Leadership Program at Centennial High School here. His name was Mike Elric. He started a blog. So this is, again, the importance of telling our story and the bravery in doing it. He started a blog online to document his story with cancer. And I was so impressed by that I just kept following that. At the time when he became hospitalized and was no longer able to continue it, his wife, who I knew better than, I didn't know Mike well, but I did know his wife, she took over that blog. And as I said, I was looking for a name for the magazine. So the one day I read her blog, and his KELP students had planted 1000 trees in his honor at Starkey's Hill here. That's my name. So I contacted Heather to see if she was okay with that, and she was, and that's where 1000 Trees came from. But it was based on, wow, the courage in telling our stories.
Amazing. Any questions at this point? So Lisa, 1000 Trees, you give back to the community. There are many other portions of 1000 Trees. There's saplings and roots and wings, and it's storytelling for other people in our communities. And who are the people that are part of saplings or roots and wings?
So saplings is a children's book publishing, and yeah, again, that kind of just, I think when you start to follow your passion, things drop into your lap. You meet the people you're supposed to meet. That's how I met you.
Thank you very much.
So there was a local author here who had written a story about the loss of his cat, and wanted that published. So yeah, so at the time, so that really is how Saplings was born. And I've now published probably, I'm going to say between 30 and 40 children's books. It's a way for people to get their stories out who may not be able to do it. Mainstream publishing is difficult to get into, and it's pricey. So it's just, and my clientele has expanded outside of Guelph. It's mainly Guelph based, but there are others. A lot of the Saplings books that I do there's a charitable component. So the authors will give back a portion to charity. Yeah, and even, and the sharing anthologies, back to that for a second. I also do now special edition anthologies of that, which there's no cost. I don't charge for my time. It's a labor of love. The only thing that has to be covered is the printing costs, and 100% of the cover price after printing is paid goes back to a selected charity. I've done one for the first one was a caregivers one, which was during COVID.
Yeah.
That one, the individual authors got to select their own charity, and they sold whatever books they could and gave that money back. So a lot of charities were supported there.
Very cool.
The next one I'm doing is for Guelph Little Theatre here. You may have heard of them, Lynne.
Yes. Just a wee bit.
Yeah. And then somebody approached me. One of my saplings authors actually approached me just last week and said, what would you think about doing a book about how our pets affect our mental health? So there's the next one.
It's awesome. How, if you could sort of look at the first story that you published, how very different that might be in the process today, and how maybe raw it was, I guess, if you will.
My own story?
Yeah, sure, if you like. Yeah.
Or are you talking saplings? I mean,
either or. How's that? Yeah.
It's interesting because I debated writing a follow-up to my own story in volume 7. I didn't. I thought maybe, but it has changed. I'm hoping to write a full book about this journey that I've been on, and I haven't. And I'm thinking, why is this not happening yet? And it's because the story keeps changing. The dialogue to myself keeps changing. And it's called Metamorphosis, but it's the subtitle that keeps changing. It was from fear to, from the fear of abuse to the light of darkness of abuse to the light of empowerment. Then it was from fear to love. And then so it's because my story keeps changing that I haven't really gotten to the place where it's like, okay, now it's time. I know it's time this year, but it's just fine tuning those details.
For sure. May I ask, Lisa, in terms of the writing process for you and getting those stories out, and for you and your own balance of that and releasing the information, I guess, if you will, do you prefer to do it in writing or do you prefer it in audio form? Some people like to tell their story first by audio and then kind of get it down on paper.
For me, it's writing because I don't like the sound of my voice.
I know.
I hear myself on tape. It's like, that's not me. So yeah, no, writing for sure, and it's usually long form. It's I find that it's, I don't know what. Well, I've heard that there's a different process when you write things with a pen and paper as opposed to typing on a keyboard. It's more personal. It means more.
I've heard that
on a different level. So I tend to do that. My story in sharing volume 1, I went up to a friend's house. He had a gorgeous log cabin up in Wyerton, sat in his living room, and I wrote that story probably in 3 hours. Just didn't stop. I had to edit it after, but it was, yeah.
That's incredible.
Yeah.
That's really amazing. Sheryl, question?
Yeah, Lisa, I've thought a lot over the years about storytelling and mental health, narrative storytelling, and it has a real place in mental health. But when it's young people or shared, it's a challenge.
Yes.
And when it's suicide prevention, it's a challenge. And online, people share a lot. I'm surprised at how much people share because I'm not one of those people who comments on, people's pages and it's all public. Do you know what I mean? I feel sort of nervous about that, putting my words out, and somewhat depends on what the issue is. But I've learned, because there's some people in my community, Americans, that do a lot of talks about narrative storytelling and whatever, and that there's a time and a place to tell your story. And maybe that's what you're sort of, you've been telling your story, but trying to articulate it. And I realized, when you're in the midst of the pain of the story, that's not the time to tell it.
Right.
It's a really hard thing for people to grasp. I was asked to speak at a university last week. It was a bit of a weird experience, the whole thing, because they said, introduce yourself, that's 1 minute. And then I'm waiting, when are you going to ask me things? But so it was, I think a lot of people don't understand what this storytelling is about. And is it just airing all your personal stuff in ways that are very unsafe? It's so sharing the story. Is it is it a therapeutic process, cathartic? Is it, listen to my story. I've never told it publicly. I need to tell it. I need to get, so I think you know, learning how to tell our stories and doing them in a safe way. We're not there. We don't understand those kinds of concepts. It's just talk. You know, creating a campaign that's focused on talk without creating context and supports and conditions for talk, when to talk, how to talk, who to talk to, why to talk, you know, all of those things are part of not just storytelling, but sharing your story, whether it's, and what is the objective here? You know, what is it to say me too, or is it to say, somebody hear me, I need you to hear me, I need somebody to validate because I didn't, you know, feel that before. You know, it's a hard thing. And, you know, I went through some difficult times in the past. And so I, you know, realized last year, because I was asked some things and I thought, I don't want to talk about that story anymore. It's too difficult. People didn't want to hear it when I was talking about it, and I was in the pain of the experience. So it was overwhelming. It was about the only thing I could really talk about, you know, because it was so much a part of my life. But when you sort of like coming out and you feel in a much better place, and then how you understand that story and how you represent it, I think is, I don't know if you've thought about those things, but I'm sure you have.
Mm-hmm. And there's been a number of people that have approached me and wanted to share their story in one of the volumes, but when they started to get into it, they thought, I can't do this, because they weren't ready. Yes. There was no, they weren't out of it yet. Mm-hmm. It was, and so the people that actually ended up published are the ones that, okay, so here was my issue and here's what I did to get out of it. Right. It wasn't a I need help, so I'm going to write this all down. Mm-hmm. But yeah, in the last volume, I think I had 3 people at the last minute say, I'm not ready. That's fine. So I'm also developing a mentorship program to help people that are in the process so that they can get to a point where, here's my steps, here's where I am on the journey. But that's a private thing. That's not going to be a published thing. That's strictly between me and them, what they do with that later.
Important. I think exactly important, because otherwise it's sort of, you know, being a witness to somebody's pain.
Right.
It feels very uncomfortable. Like, what is the point here?
Yes, exactly. These are not stories that you come around going, oh my God. It's more, wow, that's the reaction to those, because the people have come through it and they've made it to the other side.
Articulated, yeah. No, that's actually very, very appropriate. Thank you for asking that, Sheryl. I really appreciate that. Wow.
It's interesting that you say too, Sheryl, about the youth, because I dealt with a high school student who wanted to do an anthology with high school kids' stories. And this is a difficult one, and there had to be anonymity in those stories. Mm-hmm. We didn't do it because they're too vulnerable. Mm-hmm. And even if we didn't put their names on it, it's like, what if people found out who they were? There was all these liability issues. So we did not do it. And the other thing that does strike me about what you said, yeah, the online talk now is a bit scary.
Yeah.
Because people dump stuff out there, and then there's bullying and there's, you know, viciousness, and as well as people that support. But yeah, that's a difficult thing to maneuver.
Yeah, totally.
Mm-hmm. For sure. Lisa, I wonder, for your social causes that you've been tackling lately in terms of your recent work with Ed in town, if you could share with our viewers what the initiative is there.
Sorry, which is this?
That's the initiative with Ed Pickersgill. Yes.
Oh,
yeah.
Yes. So Ed Pickersgill is a local, he's very well known in Guelph here. People will call him a hero, and he gets very upset by that. But he works with the homeless and the marginalized, and has done so for oh my goodness, I think I first met Ed 10 years ago, and he'd been at it for probably a decade by then. He writes some amazing poetry, like just raw and, yeah, there's no other word to describe it, raw and very powerful. So, and he posts that poetry on Facebook. So for years, I'd been saying to him, Ed, you really need to get these published. This would be so amazing. No. And I apparently was not the only one that has been telling him this. So last summer, there was a particularly powerful poem that he wrote. Oh my God. Tried it again on Facebook or email, I can't remember now. I said, we really need to publish these. And he goes, okay. So we did. So I, again, that's because it's a charitable component. I didn't charge him for my time with editing and formatting and all of that kind of thing. We did a GoFundMe campaign and raised all but $200 of the printing costs. We printed 500 copies, and we've at this point sold over half. So that raises him $20 a copy. So he's thrilled. His poems are out there, which are inspirational in and of themselves, but it's helping. So it goes to his campaign. He provides clothing, he provides food, he provides whatever, bus passes, coffee cards, Zayre's cards to these people. And he's out there. He was doing it every day. He's now just doing it Monday to Friday because he's getting some help. People, he's in his, I believe he's in his 80s. So people are helping him on the weekends, but he's there without fail every day. He used to have a location, but he lost that when the building was sold. And given and there is stigma still with that, not saying that it should be, but there is, because a lot of these people are drug addicted. Nobody wanted to rent to him. So he's actually physically at a bench. His initiative is now called The Bench, and it's a bench in downtown Guelph. He comes there every day from, it's 1:45 to 3 o'clock, drags all his stuff on a dolly, sets it up, people come, they get what they need, and that's it.
So
that was really heartwarming to do that.
That's what I thought. It's such a, again, it's community, it's bridging resourcefulness of people together, enabling, it's all of those things that we're talking about. And that's amazing, and that's still, I'm still hearing people talk about it because it's powerful poetry.
It is very powerful poetry.
Yeah, lived experiences.
For sure. Well, people are now approaching him saying, when's volume 2 coming out? So, here we go.
So in terms of our mental health and how important that is in getting that message across for a marginalized population as well, it's so very important. And how do we address that need? And Ed's kind of, and you are collaborating to kind of raise awareness about the cause.
And that's happened a lot, actually. And so because of that book and the media coverage, people are now aware of what Ed is doing. And that's why he's getting the supports that he's getting. There's, I think, 3 local restaurants that will provide food. There's, which before he was doing it all alone.
Incredible. All those years, right?
Yes.
By himself.
Yes.
Really, really amazing.
Yeah.
I wondered, Lisa, then if you could talk to us about some of the stories that are submitted, if you don't mind, maybe even from the children, if you don't mind, for some of our listeners and viewers today and participants. What are some of the stories for saplings? Okay,
the one that comes to mind, since we're really dealing with mental health today, there's somebody that I'd met years back again, who is an educator, but she's a writer as well. She developed what is called the Emotional Animal Alphabet series. So she wrote 26 books, has 26 books. So what she does, and she loves to be in costume. So this was right up her alley. So for example, Anxious Alligator was the first one. She didn't do them in order necessarily, but she dressed up as an alligator, went into a classroom, talked to the kids about anxiety, and then went with all their ideas, went back home, wrote the story, then went back to the classroom and had the kids do the illustrations. So she's got a set of 26 books. with different, 26 different emotions, but which was amazing. It raises awareness of mental health issues, but it was also empowering for those kids because they're grade school kids. I mean, it's not professional illustrations by any means, but the looks on some of their faces when they're handed an actual book with the picture that they drew in it was huge.
That's really cool.
Yeah.
That's awesome. Yeah. I see sort of collaborations that are happening in film. I know, Sheryl, you're sort of doing directing change kind of stuff and storytelling through film. And I see a crossover here. I really do, you know, between the two types of programming, you know, and there's a way, I don't know if there's any way to collaborate at any time in the future, just storytelling together, try an experimental project. It would be really, really neat. I'd love to.
It would.
Yeah, for sure. Could you walk us through a little bit more about the program, 1000 Trees? How do you get your funding? You give a lot to the community. You don't often charge people. Part of that is really all about the mentorship support for the mental health package, if you will, getting people off and running in the right way.
It's more, again, I don't have funding. I do get paid clients, so it's not my full-time job either. So I do have outside income. This is more my giving back, and I feel so strongly about empowering other people. In 2018, I was honored as one of the Guelph Wise Women of Distinction for those efforts because it was recognized that how important it is to provide a platform to do that. So I'm not in it for money. I'm not saying that I don't like the money, but it's not my main reason for doing what I do. It's more because I feel so strongly that we have a need for that.
Mm-hmm. And that's, again, connecting to what Sheryl had said too, right? Mm-hmm. It's not necessarily the funding there, but it's a work of passion. And right. The core of you are in your humanitarianism, right? Yeah, no, that's so very cool. If someone, I know we have a bit of time here to kind of open up the conversation a bit, if we will. So we're talking about publishing, yes, storytelling, but if you were to mentor somebody else, what would that process look like? Let's talk about the new project, for example. What do you expect from that? If somebody wanted to have that one-on-one with you even? Mm-hmm.
I've had 2 people approach me actually that I'm currently starting to work with. One of them's a little further along, so she's got her story pretty much written. She just wants to have it fine-tuned, and is she missing things and that sort of thing. The other is totally brand new. She's got her story, but she's one of the ones that dropped out of the anthology at the last minute, saying she wasn't ready to do it. Mm-hmm. So I just said to her, what would you think about going? So it's going to be either a matter of Zoom calls or phone calls or just emails back and forth, asking the questions to get her started, and then providing feedback on what she said. She will provide questions if she has them. I've not done it before, so it's going to be a work in progress, but I'm excited about it. And given that, I just mentioned it last week, maybe the week before, and 2 people, oh, I want to do this. So
that's really cool.
Yeah. And we'll see what comes from it. I know one of them actually both of them want to eventually have a full length book rather than just a story in an anthology. They want to do the whole book. So.
That's amazing. I had the opportunity to interview Maya from Nova Scotia, for our viewers here today and participants. If you could maybe tell us about Maya and how she connected with you. Yeah.
Maya was her sister. No. One of my writer's sisters knew Maya and mentioned, because Maya she's a teenager out in, I think at the time she was in grade, I think I'm going to say 10, out in Nova Scotia. She's another one that writes. Poetry is a difficult thing. So a lot of people will ask me to edit their poetry. You can't edit poetry. It's so personal. It's right, unless there's spelling errors or grammar errors, of course, but I don't. So, but she had this book or collection of poems on a mental health theme that she wanted to publish into a book. So she sent them to me, and for for a 14-year-old girl, I read these poems. They were phenomenally powerful. Whoa. So we did that. So, and she's now, I've published 2 of her anthologies. They're available both on Amazon. Yeah, about her experience with mental health, about her, just issues growing up as a teenager. So she was thrilled, because where is a 14-year-old going to get her book published? But so that's where we connected. And yeah, she did contact me after the first one went up and asked if I'd be willing to consider doing a second one. So I did, and they were equally as powerful.
Oh, goodness gracious, yeah. So Maya Serbu, S-E-R-B-U, if you want to look her up, Maya, M-A-Y-A, fantastic
Yes.
young poet. Love to connect with her again sometime in the future.
Yes, for sure.
It kind of leads to our next conversation, intergenerationally, the people that you're reaching right now. So Maya is a young person. You've got even younger that you're dealing with saplings. Could you speak to the other end of the spectrum, maybe somebody in a later point in their life, sharing and storytelling?
Well, Ed, for sure. Trying to think. Yeah, I mean, it runs there's a whole age range there. I did publish another book for a gentleman. He's in his, I'm going to say 60s, who he had I think his brother died by suicide. 2 brothers died by suicide. His wife, his daughter all suffer from bipolar. So he went on this motorcycle. Oh, he's a long distance runner. So he doesn't do it so much anymore, but at the time he was doing what's called the Canal Pursuit for Mental Health. His name is Clay Williams. Ran from Kitchener to Ottawa. I think he was doing 200 kilometers a day. It's insane. That's a terrible pun, and I didn't mean that. Let's clear that out.
Fair enough. Yes. Thank you.
But what he was doing was carrying the Canadian flag in his backpack, and he would stop along the way. So he did this over 7 days, I believe, and talked to people about mental health. His whole point is to raise awareness. He has people sign that flag. If anybody has had mental health issues, no one knows somebody that has mental health issues. And he carries that flag, and he says, I'm carrying this flag as a symbol that you're not doing this alone. It's like, I'm carrying your burden with me.
Oh my goodness.
So phenomenal. So he also did, he's a biker. So he took a bike trip throughout southwestern Ontario to visit the graves of his brothers, and he documented that in a book, which I helped him publish for him as well. Again, raising mental health awareness. Through all the trauma of that and losing his brother, he had lost contact with his sister-in-law due to a number of reasons, because of the death. And as a result of that book, she did reach back out to him, and they've reconnected. And I think she ran the last leg of his last run between Kitchener and Ottawa with him. She drove up and ran with him.
Oh my goodness, that's incredible.
Yeah.
Wow. That's yeah. It's interesting. So Lisa, you have a lot going on, and so for yourself, and in terms of the writing process for you, it's I guess it's I find it's very important to find an outlet. Having worked in the mental health field myself as well, being a teacher, worked with international students, newcomers, et cetera, et cetera. I think everybody needs an outlet. Everybody needs a forum to be able to do that, right? Yeah, so working with systems in the sort of in each city is very, very important. Do you get any support from other people in the community, or for example, anybody from the University of Guelph, students working with you, students offering their services, trying to get hours in as a university student to get the experience, or
I think at the time I have had students sort of what's the word, not apprentice. I don't currently. I do have two people that subcontract under me. One is an editor and one is a writer, a ghostwriter. So I do provide those services as well. I do have a lot of people that want stories written but don't want to write them.
Yeah.
So I do that. Yeah, I mean, I'm getting a lot of connection with local organizations and people that are learning more about what I do. So the word's getting out there, which is why I did this to begin with.
Yeah, well, for sure. Question at all, Sheryl, just listening in?
Not a question, but, you know, I think like, I wouldn't have thought about, you know, writing books like this, although that's what I do as a teacher all the time, as an educator, is that I put materials together as books. But when we were creating a couple of years ago, we were, you know, focused on creating self-care toolkits with different kinds of aids. And somebody I know from the United States, she developed a creative journal workbook, and, you know, looking at hers, and I was trying to find a way that we could include it in the kit, and that, you know, but she didn't really get the idea. And I looked at it and I thought, I could easily write one like this. This is what I do in teaching every day. And, you know, and going from there, and then, you know, and then how can you, like, really finding the supports for that. So in the end, I found a publishing company that does self-published work. So I didn't know about that field of self-publishing. You know, I think is more like what you're doing about, you know, creating a copy or a couple of copies or whatever. Not what I'm doing is mass producing, like, you know, so I'm working with a local printer, and I worked with so I thought she would be doing the design of the book, but she doesn't. So, you know, somebody had just graduated from graphic design and had told me she wanted to volunteer. And so she's done the graphic design for the books. And now I have a placement student. I wrote another book and we're working on that. But, you know, all those steps that are involved, and how do you create the framework for telling your story, you know, and like that self-publishing has opened up the world to a lot of people. Right. Yeah. You know, I mean, like, when you don't have to go to, you know, a publisher, a company, and for them to decide if they want to publish what you have, when you can just do it yourself, it really, you know, is a really important vehicle for change.
Yes, and it has changed a lot. There's not the stigma anymore with self-published books. It's become perfectly acceptable. It used to be many years back, oh, we don't look at self-published books. Even you would never get to a mainstream publisher if you had had a self-published book first, but that has changed. But yes, many people, it's because you bring, with a self-published book, you're going to retain all of your rights, all of your proceeds. It's a great way to go. A lot of my clients have their own target market. Like, a lot of them will have there's counselors or whatever that have walk-in clients to their locations, so that, and here's my book.
Yeah.
Yeah.
Okay, interesting. Yeah. Somebody, you know, when my books were first published, or printed, I should say, and somebody made a comment, oh, they're self-published. And I could tell by her tone, because I hadn't thought about them that way. Self-published. Right. I thought, well, they're published, like printed. And yeah, but you know, so I don't know, like, so you feel that it's changed, that kind of attitude about, so in what way do you see the change happening, that there's a level of respect if you publish your own things? Where do you see that happening, or what kind?
Well, just the fact it's not, people don't look down their nose. Some do, obviously, but for the majority of people, they're not looking at, oh, well, you only self-publish, it doesn't really count.
So like a B category kind of thing.
Yeah. That's not the issue anymore. I mean, people are looking at the book. What's in the book? What's the content? Not where'd you get it done?
Yeah, it's interesting because, you know, in my field, I always research what exists internationally, and there's not much that exists.
Right.
in mental health
No,
as
it's true.
resource, as hands-on tools.
Right.
So yeah.
Yeah, it's true.
Mm.
No, that's really, really cool. I wonder then if we could maybe just open up the floor a little bit between Lisa and Sheryl on why, how important it is and why it is very important, not just for our young people, but our communities to mental health education, the progressive society, why we need those in place. And just from your own personal thoughts. Yeah, I'll start with Sheryl, actually. So Sheryl, we have about 15 more minutes.
So I'm not sure about the question.
Yeah, did you freeze too?
Oh yeah, for sure. I'll just wait. Did I freeze? Okay, yeah, I love that. So I wondered if you both could speak to why it's so important to have those. I think we know why, but if you could articulate it, why it's so important to have those systems in place, those supports in place, more than ever, and especially coming through COVID times, post-COVID times as well, to address those mental health necessities. If one of you could speak to them. Yeah.
Yeah, I can definitely. You know, I was asked this, I think last week, and yeah, I did a film shoot last week for, it's a government training video or film or something, because employers don't know how to work with placement students virtually. That's a challenge. It's not a challenge for me because we've all, you know, the bulk of what I've done has been online. And so extending, you know, I have dream projects, like things, like a million things I would love to do. But I think, you know, how to characterize the mental health response that is possible with the pandemic. Before the pandemic, it was, this exists, these supports, these services exist, you have a wait list, all this is in person, this is how we do things, this is status quo. With the pandemic, it's shaken everything up, right? And so where does that put mental health organizations, the corporate kind, I mean, well-funded, publicly funded corporate mental health organizations, when they don't have in-person contact with people, you know, or professionals, when they are not able to have in-person contact? Does it mean you don't provide support? You don't provide services? So how do we look at supporting people in really innovative ways? And I think this pandemic, if you are the kind of person who can think outside the box and go beyond status quo, it's provided a lot of opportunities to really rethink everything about society, about community, about how we support each other, how we take care of each other. And so, you know, doing virtual workshops, being accessible, you know, being in the homes of people, making those connections. I mean, I teach online every day, and I live alone, and I, you know, have a puppy now, a pandemic puppy. I think if I didn't have those daily contacts online, and I, you know, didn't have my pandemic puppy to go for walks, and I live in a very friendly community near McMaster, that I think it would be really challenging. But I hope that this is a kick in the pants for mental health to say, you've got to do much better. You can't just say, I'm sorry, it's a pandemic, we can't serve you, we can't do this, nothing's possible, but really look at what you're doing and going beyond it to say, we can do better. We need to do better. These are the ways we can do it. Let's go online. Let's have regular conversations, mental health chats, mental health workshops. Let's do, you know, school workshops, and let's stop putting all the barriers up in, you know, in the way of really creating that world, you know, that's stopping the mental health education and support and change that needs to happen. Because really, systems and professionals are putting up those obstacles, and we need to take them down. And the pandemic is saying, you need to find new ways to be accessible to meet the needs of people. So I hope that happens.
So do I. Ditto. Ditto.
Because we're doing it.
We're doing it now, right here.
Yeah. Well, YMHC is doing it. We're doing
Right?
it. And I believe we're a leader in Canada and internationally for what should be done, it can be done, and is being done by YMHC.
Oh, for sure. And when you articulate that, Sheryl, the way you have through the program and the past program, it totally puts it in perspective on what is actually being done with your organization. So I certainly hope that people take a look for both of you and what's happening and what you're offering to your communities. Lisa, you were going to jump in. I think I interrupted there.
Well, it's interesting because I think because of the pandemic, I suspect that's why I'm getting more people contacting me, because they are isolated and it's like they're trying to find, I need to talk, I need to tell my story, I need to connect. Because I've had more people now contact me in the last year than ever before. Again, the word's getting out, and I think that's because people are online so much more. They're not out and about, so they're checking things out. Because I've had people call me, and how did you find it? Because I always ask, I'm always curious, how did you find out about me? Oh, I was just Googling. I was okay, this is kind of cool. I mean, it's not ideal that we're all stuck in our houses. Hopefully that will change soon, but there is a benefit to it because people are reaching out in different ways.
Yeah. And that's sort of what we said at the onset of the other program. It's really reconfiguring the framework of what we have to offer.
Exactly.
In all aspects of society. I know Sunil has a question. I know he's thinking of one right now. The floor is yours.
What are you thinking, Sunil?
You're going to type it in the chat. Well, I think I'm very proud to I invited you back again for other viewers to be able to get a chance to listen to you and what you have to offer, because there really is so much what's happening and positive change that's going on in our communities. And I'd love to see more people reach out to you should they ever need you as a resource as well. I wonder, Sheryl, and Lisa, if you have a moment to kind of just regroup again, just recap what your org does and how people can reach out and get in touch with you. Lisa, do you want to take it first, or Sheryl?
Sure. Yeah, my main website is www.1000trees.com. Again, I'm a publisher. I believe in the importance of telling our story. Empowerment through storytelling is my thing. So yeah, 1000trees.com. It's all words, all one word. So not 1000, but 1000. From that website, there's links to my other websites, to my Roots and Wings website, to my sapling site. I have a bookstore site, and there's a specific site for the sharing anthologies as well. So you can link to it all from that website, and my contact information is there. And I'd love to help you tell your story.
I love it. Enabler. I love it. Thank you so much. Sheryl. Yes.
So Youth Mental Health Canada is in Hamilton, and we're at the Workers' Arts and Heritage Centre. I think we will have Saturday drop-in hours, so people can always send an email. You can contact through, we have 3 or 4 different websites, so mhc.ngo, we have an education website. People can read more about the workshops we do, and I tailor make them to particular needs. But I did 2 10-week workshop training series. Last year, I'm doing all kinds of workshops for schools, community organizations, all across Canada this year. And we have the store with the resources and wellness packages. So I've just developed 9 mental wellness packages. We have some special deals. So if you get the COVID book, you order 20 copies of this particular book in this together. It's a COVID mental wellness journal workbook. And it incorporates international best practices in mental health and wellness, which are social emotional learning, CBT, which is cognitive behavior therapy, and DBT, which is dialectical behavior therapy. And so if you buy 20 or more, then there's big savings, and I'll have another book, Sources of Support, with also a special offer. But yeah, I think, just following us, especially on the Facebook page, that, people are really engaged there. So if there's any news or, things that we're doing or whatever, I tend to put things first on the Facebook page. So that's Youth Mental Health Canada. So definitely follow us. I'm working with 7 placement students now from universities and colleges across Canada, and 1 from Zimbabwe.
Oh, very nice.
University. So yeah, I think we're producing some amazing resources this year. I'm pretty excited about them, and we should have our multilingual digital packages on the website soon. So that I think that will really support communities in Canada and internationally, which is great. So yeah, we've got a lot going on, and hopefully it's all great, positive, everything I've been building the last 8 years, great things will continue to happen. So thank you.
Oh,
Then just let me, I forgot to mention, I am also on Facebook.
Nice. Thank you.
Through all of those divisions. So they're there as well. And I do have a lot of interaction there. A lot of people reach out to me that way.
That's awesome. If anyone wanted you to be a guest speaker at all, Lisa?
I'm sorry?
If anybody ever wanted to invite you as a guest speaker in an English studies writing class or something like that, would that be of interest to you as well? Do you ever do things like that?
I have done. I did run a workshop at University of Guelph a couple of years back. I used to also, before COVID, did what was called sharing evenings. I wasn't the speaker there, but I would bring in speakers on a specific topic. That was really well received in the community. Mm-hmm. I will be doing something similar once we are allowed to get back together.
Well, that's awesome. And thank you so much for both of you. And I have one quick question about directing change. If anybody was interested in directing change in Canada, Sheryl, would they reach out to you through Youth Mental Health Canada, or is there another way for someone to raise that conversation?
Well, so that website, all the information about directing change is through our main website, Mchte.ngo. So we have a link there on the top tab. There's a link to that website, so people can get information there. Yeah.
That's awesome for both of you gals. Final question from Sunil, I guess. Yes.
It's not a question. I just want to say that we also going to be sharing about Lisa and Sheryl's information on our website. So our viewers also can join, because these things cannot be done by one organization or two. It should be done by all the organizations coming together, focus on same thing, not different things. So we're going to be sharing all the information, their email address and website and Facebook and stuff. All the social media be on our website too. So people can, if they come to us, they have any question, they can see, they can click, go to them. So we are all working together for the betterment of our communities.
Wow, what he said. How can I repeat anything? That's awesome. Absolutely that. To all of our viewers that joined us today, I'm very grateful to, we're very grateful to Moksha Canada Foundation for allowing us to raise this conversation over this 2-week span, but also this 28-week program on Spotlight on Community, allowing these wonderful guest experts to come in and shine light on our communities and all the wonderful things that are happening. Thank you so much for joining us. We look forward to seeing you again. Follow us and get involved with Moksha Canada Foundation and follow us on social media. We're so excited to see you, and come and celebrate life with us. Thank you for joining us.
Thank you.
Thank you.